please follow our social media accounts, our Facebook page, Simply Nature International, our IG account, Simply Nature Inc., and of course, our YouTube channel, Simply Nature. Don't forget to subscribe and click the notification bell for more updates.
Hello everybody, welcome to another episode of Simply Healed by Simply Nature, and today again we have Dr. Jimmy Catapia, our regular oncologist, who is here to share with us on prostate cancer. So welcome Dr. Jimmy.
Thank you, Sean, and thank you everyone again.
Yeah, we're back. The last time, Doc, when you were around, you were talking about colorectal cancer. So, in layman's term, that's the cancer that deals with the poo-poo, right? And today we're going to talk about prostate cancer, which is cancer related to the wee-wee.
Yes, to the wee-wee, the urogenital system.
All right, and colorectal cancer was the number 3 killer among men and number 5 overall. But for prostate cancer, what's the ranking for prostate cancer?
Actually, for males, it's the number 2.
Wow, for males it's number 2. So for all the guys out there, what's number 1 for males?
It's still the lung cancer.
Lung cancer.
Yes, because of smoking.
Because of smoking. And lung cancer is, very lethal, right?
It's very lethal.
Lung cancer is very lethal. Doc, I hope one day we can talk about lung cancer.
Yes, that would be a good topic.
That would be a good topic. In fact, if you are diagnosed with lung cancer, is it most often caught in the late stages because it's a
most of the time.
Because it's a very fast cancer. And if you are diagnosed with lung cancer late stage, what's the average lifespan a doctor onco will give you?
Again, it depends on the stage. If it's stage 3 or stage 4, but more if you're caught in the very late stage, stage 4, we actually tell them that their expected lifespan is around 6 to 12 months.
Yeah, that's what our experience is with patients also when they come and share with us. So if that's a topic that you are interested in, and since it's the number 1, right? Number 1, I didn't know lung cancer was number 1 for men. So I'm sure in every family there's the men, because there's your dad, there's your uncles, your brothers. So, Doc, that's a great topic. Can we invite you for a topic? If you would like to hear Dr. Jimmy talk, our oncologist talk about lung cancer, please type it in right now under the comments so that we will know if this is a topic that you want to know more about. But today we're going to talk about prostate cancer. So, Dr. Jimmy, first question I want to ask is, what's the overall success rate of treating prostate cancer? Can it be caught early? I mean, lung cancer is difficult to detect early, but for prostate cancer, is it detectable earlier? And what's the success rate if you catch it early?
Actually, prostate cancer is a slow-growing cancer.
It's a slow-growing cancer.
So even for early stage, like stage 1 prostate cancer, some would not even give treatment.
Yes.
You just observe it.
Yes, I read. I know I'm a Google doctor. I always Google about all these things. And if you check prostate cancer, one of the standard practice is to wait and watch.
Yes.
Right? So
watchful waiting.
Yeah, watchful waiting. So, but Doc, are there early signs and symptoms? How do we know that we might have prostate cancer?
Okay, number 1, we have to consider the age.
Okay.
Because the age group that prostate cancer is most common is those that are in the age group 50 years old and above.
Oh, so I have to go test myself in 3 years' time. Yeah, I'm 47. All right, okay.
So for symptoms, some would present with painful urination.
Or painful urination.
Yes, or a blood in the urine.
Blood in the urine.
Or a blood in your semen.
Blood in your semen,
Yeah.
all right? Okay. Any other symptoms?
If it's in the late stage, some will present with bone pains in the pelvic area.
All right. So that's because of the kidney or what?
Because of metastasis to the bone in the pelvis.
All right. Okay. Well, metastasize to the nearest bone area, which is your pelvic area.
Some will also present with urinary retention or incontinence.
Okay, so all these don't mistaken it for OH, right? If you can't incontinence, right? It's not because you're growing older you can't control your bladder. It might be prostate cancer.
Good day, everyone. If you want to have an online consultation with me, just comment down below and our team will contact you after.
So doc, if a patient suspects themselves of prostate cancer with all these symptoms, when they go and see an oncologist like yourself, what will be the process that you would take them through?
Okay, just like in colorectal cancer, the doctor will usually perform a digital rectal examination.
Oh, still examine the rectum.
But
All
this
right.
time they will palpate for the prostate.
Oh, they will
Yes.
press around for the
You
prostate
can actually
area.
palpate the prostate via the rectum, no? It's just at the anterior part of your rectum because the prostate gland is just under the urinary bladder.
Okay,
Yeah.
so that will be the first examination. And after that, if it's negative,
The doctor will palpate your prostate gland if they palpate something suspicious. For example, it's hard or there are nodules in your
bumps.
prostate. Yes.
Yeah.
The next step is to undergo ultrasound, transrectal ultrasound of your prostate, and then possible biopsy of a finding in the ultrasound.
so if you have the symptoms of like a little bit of blood in your urine and some pain, and then you go for the digital exam, there's nothing, that means no nodules, and then you do ultrasound, it's clear. So then you will be able to more safely rule out prostate cancer, right? And you can say it might be a urinary tract infection or something like that. All right, so to our listeners out there, so don't be afraid. Again, just go do a simple test. It's in fact, I learned the last time, digital examination is part of the consultation, so no extra charge. No extra charge, right? So don't worry about it. It's not no prohibitive cost. And if that we do find something, no reason to panic yet, right, doc? Because prostate cancer is the slowest, one of the slowest growing cancer. And as Doc Jimmy said, if you are caught in the first stage, the strategy is to wait and see, right? There's no even going to be any treatment protocols being applied to you yet. But if it's caught in a later stage, what would be the treatment protocol?
So it depends on the stage. Most patients will undergo radical prostatectomy. That's a surgical procedure. Okay? And then it can be followed by hormonal therapy, and then regional chemotherapy, and also radiotherapy.
Wow. When you do surgical procedure to the prostate, I think since all the guys are listening, will it affect our performance, sexual performance?
Yes, that's one complication of prostate surgery.
Okay.
Okay, you can have incontinence, you can have erectile dysfunction. That's very dreadful.
Yes, that's very scary to all the listeners, and also even to the women, because it's for the wife, right? Yeah. Wow. So, but since since prostate cancer is slow growing, are there alternative treatments that we can try before we even go for surgical procedures?
Yes, some will only give you hormonal therapy.
Hormonal therapy.
It's not expensive, and it's very convenient to take.
Oh, okay. So there you go, right? If you want to avoid having surgery that might cause erectile dysfunction, get it early so that you can start your treatment early.
Good day, everyone. If you want to have an online consultation with me, just comment down below and our team will contact you after.
Actually, Doc, we have many patients who have actually used SimplyNature PPARs on prostate cancer. In fact, one of my early interactions with a medical doctor here in Philippines, right? Is one of our doctors. He was supposed to go for chemotherapy, and he looked at his PSA level, right? Yeah, and he's actually been surviving on soft gel capsules. He is now already, I think, how many years? Santos, do you remember how many years with Doc? 6 years already, I think.
I think 6 years.
6 years already.
Yes.
Yeah, so
you told me about him. I think 5, 6 years ago.
5, 6 years ago. He's still around. He's now in his 80s, and his prostate cancer is still under control. He's still very suave and dashing and very, very active. So there you go. There are actually treatments for prostate cancer.
I think his PSA is in normal levels.
Normal levels.
Yes.
In fact, his urologist requested a meeting with me because he was surprised that the doctor's PSA levels was actually normal.
Okay, for our viewers, PSA is actually prostate-specific antigen. It's a tumor marker for prostate cancer. No?
So there you go. Now you know what PSA are. Can prostate cancer actually kill you, doc?
It can.
It can.
In the later stages, of course it can. It's still a cancer even though it's slow growing. It can metastasize to the bone, and in very late stages it can even metastasize to other organs of the body.
Yeah, so what we always want to avoid in cancer is metastasis, because 80% of cancer death actually results from metastasis. So if your cancer is still localized, you will have a much better chance of really defeating the cancer. So again, our advice from all our doctors is don't wait. Seek consultation and start on a treatment protocol. There are many options. SimplyNature PPARs is one of them, and if you ever go for chemotherapy, make sure you start on your SimplyNature PPAR soft gel or extracts. That will make your chemotherapy much better. Doc, would you endorse our for chemotherapy patients to go on our SimplyNature PPAR extracts?
Yes, of course, because it really lessens the side effects of chemotherapy. I've given it to my patients, so I've seen the result.
Thank you, Doc. Nothing beats actual results. So, Doc, I think prostate cancer is simple. We've covered much of it, but I think what people really want to do tonight is ask questions. So, Doc, any last words before we go into our Q&A?
Okay, so of course my message for all the males out there, because prostate cancer is a male problem, no? So if you're in your 50s already, go to your doctor, have a digital rectal examination. No, I know it's uncomfortable, but it will save you. Okay.
Wow, I really want. Now I just caught this from you, Doc. That it's so important for us to go for a digital rectum examination for prostate cancer if you hit 50. I want to stress so much because in talking to Dr. Jimmy today, I realized it's just a simple examination, right? It might be a bit uncomfortable where Dr. Jimmy is going to stick his finger, right? But it's just to check if you have any irregular tumors,
suspicious tumor in your
suspicious,
prostate.
and if you do have prostate cancer, is a slow-growing cancer. There are so many options to treating it.
It's
without
manageable.
Manageable. No need to do for surgery. And I know in Philippines, men want to be active all the way. All right, so you want to avoid surgery that could result in erectile dysfunction. So I think that's enough motivation for us to go for a rectal digital rectum examination the moment you hit 50. And of course, if you are past 50 and you haven't gone for such an examination,
Do it now.
do it now. All right. So without further ado, let's go to our Q&A.
Hello mga ka-SimplyNature! Please follow our social media accounts, our Facebook page, SimplyNature International, our IG account, SimplyNature Inc., and of course, our YouTube channel, SimplyNature. Don't forget to subscribe and click